I talked about stress reduction. I do think that's extremely important. There's a lot of different, I'm sure you guys have a lot of different, stress reduction techniques, but I have a whole list of different things that they can do. One of the things that I did, I thought was really important. It was recommended to me by a friend that had myeloma, is to go to a psychologist. And I did do that. I had 3 visits with a psychologist that specialized in cancer patients. And that really did help me a lot because, you're dealing with this whole thing with death. You don't think about it every day, but, you're thinking about, hey, what am I going to go through? What's it going to be like? Am I going to be in pain? What if I do get pain? Are they going to be able to keep it under control? One thing she told me that really kind of allayed me, she said that in the last 3 months, when patients know they're going to die, she said they're at peace with it. That made me feel good. And now she said there's 5% that go down kicking. They're going to Mexico and everywhere else. But she said 95% are pretty much, they're at peace. They've made peace with it. They know they're going to die and they just, and that really did make me feel good. So I do think that's really important to see if you could seek out a psychologist that does have experience with, with cancer patients. And sleep is so important. I mean, you really need to try to get at least 7 to 9 hours of sleep per night. And that's really when all of your DNA repair is going on, a lot of the detoxing of your body's going on, autophagy. It's just, when you go through some of the studies, for instance, night shift workers, there's a lot of studies that show that, they have much higher cancer rates compared to the average population. In fact, there's one study with prostate cancer, people that did work night shift, it actually took them 20 years if they started to get on a regular study, to get back to like a baseline. So night shift work and not getting good sleep really enhances your chances of getting cancer. In fact, one study that I read, they took people that had 5 hours or less of sleep and they followed them for 25 years. And they found that people that had 5 hours or less had a 25% incidence of premature death. So it definitely isn't a good thing. And one thing that is important, we were talking about the DNA repair going on at sleep. What most people don't realize, and I learned this early on when I had myeloma, there's a very famous myeloma researcher. His name's Mikhail Munchki, and he wrote an article in Nature. And what he said in that article is by the time you get diagnosed with myeloma, the cancer that I have, you have about 5,000 DNA mutations in that cancer cell. And by the time you relapse, you're at about 12,000 DNA mutations. So that's one of the reasons why I promote a whole food plant-based diet. Plants have 63 times the antioxidant power compared to animal products. So these antioxidants are going to neutralize a lot of these free radicals that are actually being generated by these chemotherapeutic drugs. So I think that's one of the reasons why these free radicals really, kind of get out of hand. I do think that doing good herbal, I do everything pretty much through herbal supplements. I think that the antioxidant power in there can neutralize some of that DNA mutation. And also, getting that sleep at night is going to help repair some of the DNA mutation that's occurring overnight. The things that I've added, when I write a second edition, is intermittent fasting. I do think that's important. And in fact, I do have one study under exercise, because fasting and exercise have a lot of similarities. But there was one study where they looked at breast cancer patients, and 13 hours was kind of the cutoff. If they fasted 13 hours or more every night versus 13 hours or less, the people that fasted over 13 hours actually had a 36% reduction in their breast cancer rates, relapse rates. So I do think when you do intermittent fast, I do a 16-hour fast, I eat in an 8-hour window. I think you're giving your body much more time to focus on repair, getting rid of a lot of the misfolded proteins, repairing DNA, doing detox. All that is important. As you know, we're exposed to so many toxins in this world. So when you give your body about 16 hours to kind of focus on, getting rid of a lot of the toxins and being able to do a lot of DNA repair, I just think you just have to make it a point. Even if you wake up at like this morning, I woke up at 6 hours. I just stayed in bed. Because I eventually went back to sleep. And I think sometimes people wake up and they go, okay, I'm done. And I think sometimes if you just stay in bed and just kind of train your body, hey, I got to get 7 to 8 hours of sleep because it's really important to me.